So there are a number of different actions, a bundle of actions that a provider can take to try to ensure that someone who comes through the doors of A&E is identified quickly by monitoring them. Bloods might be taken to determine if they've got infection. They certainly will have an IV entry point put into their arm, or maybe into another part of the body, to allow access for IV antibiotics, intravenous antibiotics, which can certainly help treat any serious infection as quickly as possible. So we look to make sure that they get the antibiotics when they go into AED as quickly as they can, because research would suggest, if that happens, that the outcomes for the patients with sepsis are much better. And there are other things as well to ensure that they've been monitored properly, and to ensure that major organs in the body aren't sort of starting to be affected by infections. So we'd look to make sure that someone's urine output is monitored as well, which obviously that tells us that the kidneys are still working as well. So there are a number of different actions that we as commissioners would look to monitor with our providers to ensure that they're being carried out for patients who may be suspected of having sepsis.